sure I really said all of that stuff. Okay, so we all know that incontinence is normal after having a child, right? Or that getting older means that sexual pleasure will deteriorate. Or that it's normal to put a pad in to go for a run. Maybe not your athletes, but some athletes. Is that right? It's not right, it's wrong. So we should expect to be continent, have great sex, right Nina, and be pain-free throughout our lives. I'm a pelvic floor physio, and tonight I'm going to talk to you about some taboos, like the penis and the clitoris, and incontinence and sex. I'm going to break down some misconceptions. So when people come and see me, the most frequent thing they comment on is they say, "Why didn't anyone tell me this before? Why didn't anyone tell me not to push out my bowel motions? Why that's not a good idea." And it's not a good idea just to pee just in case you're rushing off to the shop or something else. And that sex doesn't have to be painful. And why it's so important to correct your posture after you've been pregnant or during pregnant back into some good alignment. So tonight I'm going to tell you a little bit more about this stuff. So I gave up a career travelling around the world, working as a general physio after I had my child. My child was blessed with a head, and labour and pregnancy reduced my pelvic floor to rubble. Complete mess. So I'm okay now, don't worry. After that, the science of incontinence and the wonders of the pelvic floor were really quite fascinating to me. So I work with pelvises now. After having my son, I was horrified that with my skills as a physio, my skills as a therapist, I really couldn't figure myself out. After being in labour for 55 hours, Bubs got stuck. I needed an emergency C-section. After a couple of complications and an epidural and a few more surgeries later, I was left with a body that really didn't work. It didn't perform its day-to-day duties. But I thought, at least I've had a section, I've got away with the pelvic floor damage, right? I was really wrong about that too, really wrong. But 80% of women, they have a child at some point, and 90% of women have damage to the pelvic floor during that first childbirth. So I figured I really wasn't on my own in this problem. But where was my help to recover from this? I mean, I had my 6-week checkup. Yep, stitches are good. You're handed a flimsy pamphlet. Do some squeezes, squeeze, pelvic floor exercises. But what do you do after that? Left to your own devices. I mean, if I'd injured my knee, I would be, right, ice on the knee, get the range going, get the power going, off you go, sport-specific exercises, jumping, whatever Mirren teaches you, that would be good. In full rehabilitation. But I'm here with this body that is, it's not the way it used to be, and it's fragile, it's vulnerable, and the muscles have stretched more than 200%, this magical muscle. And at this time, women are left to their own devices to recover. I saw this had to change and developed a very healthy obsession for pelvic health. If these problems were not corrected in the postnatal period, they would continue for life. So, if only we were set up like other countries. I mean, what about how the French do it? Take the French. After every baby, French women get 10 sessions of pelvic floor physio to help them recover from pregnancy and childbirth. They call it la rééducation périnéale. Sounds good, right? So this is ideal. Maybe if we're more like the French, I wouldn't get women coming to see me saying, "So I've been leaking a little bit since my baby, my first baby." And I'll ask them, "So how old's your baby now?" And she says, "Well, he's 45 now." So when clients come to see me, they've decided to make a change. But lots of people put up with incontinence. So they don't want to talk about it. It's embarrassing, it's shameful, it's humiliating. And they just disregard it and close it in. But 1 in 3 women wet their pants. 1 in 9 men wet the pants, they leak. So Why are you laughing? It's not funny. But most of the men, some of them have had prostate surgery, and 1 in 10 people, it's not pee that they leak, it's poo. So it's equal for men and women. So apart from being a bit embarrassing to some people, it costs the government $2.2 billion every year. So 75% of pregnant women or early young mums, new mums, wet their pants. And if you're leaking at 35 weeks pregnant and 6 weeks postnatal, the chances are you're still going to be leaking 5 years down the track if you don't do anything about it. That's what the research tells us. And leaking in late pregnancy and early postnatal, it doubles the risk of postnatal depression. About 30% of women, of people who have urinary incontinence, also have depression. It's serious stuff. So the majority of women who experience urinary leakage, they don't seek help. They pad themselves up and they just carry on, which is a real shame because research tells us that stress incontinence can be about 80% cured with pelvic floor physio. I mean, that's really good. That's more effective than drugs or surgery or anything. So, and maybe you could do away with those incontinence pads that you kind of put on and they stick up to your labia. It's not really that nice. Ugh. So, I want to ask you a question. Hands up if you've had back pain. A few people. And so look around, this is the prevalence of pelvic floor dysfunction in a lifetime as well. 70 to 80% of people will have problems, same as back pain. So, hands up who's had treatment for back pain. Okay, good. So I haven't seen all of you in clinic, so why is it so commonly that you seek treatment for back pain, but you don't seek treatment for pelvic floor problems? You should expect to be continent just like you expect to be out of back pain. Part of the problem here is a misconception that incontinence is normal. It's a normal part of pregnancy and motherhood and getting older, and we really need to change this. Let's get this so clear right now that incontinence is common, but it is not normal. But the incontinence product manufacturers, they want you to believe it's normal. They make $500 million profit a year if you do. So I brought along a pelvis for you to look at. Well, I brought two, but you'll only see one tonight. You will. So the red bits, that's the muscles on the inside. The white bits are the bony bits, and the pink bits here, you should be able to recognise them, because this is, you're either sitting on a vulva or you came out of one. So this is a female one, but surprisingly, men are quite surprised about this, but men have pelvic floors too. They do, and things go wrong with them as well that you need to know about. So the function of these muscles, whoops, there we go. Don't get distracted by the large male bits there, but focus. So the function of these muscles, they lift up. They lift up and they stop your organs from falling out. So that's really quite important. It has to resist the forces from above, which come down on them when you cough or you sneeze or you laugh. When that pushes down, these wee muscles should push back up, and that's what keeps you dry. That's quite good. So if there's not enough strength in these muscles, you can get leaking under that pressure, and that's called stress incontinence. Weakness can also contribute to pelvic organ prolapse, which is when your pelvic organs drop down and sometimes outside of your vagina. Half of women over 50 experience prolapse. So the sexual function is wrapped up in these little muscles. The nerves that supply your muscles also supply your tickly bits. So ladies, if your orgasms are a little bit weak, chances are your muscles are too. But what I know is that if you get these muscles functioning properly, that you can have stronger orgasms in just 2 weeks. So I'm going to ask you another question. Who here's got pelvic floors? Yay! Good, you're listening, this is good. So raise your hand if you've heard of pelvic floor exercises. Good? Good. Hands up who's done their pelvic floor, who does pelvic floor exercises. Oh yeah, that's pretty good. This is pretty good population. So, no, you're moving from your bum. Leave your bum relaxed. Good. Your eyebrows down, Emma. So it's proven that we know really good research to show that pelvic floor exercises can have a big improvement in incontinence if you're weak. It's really good exercises. For men after prostate surgery, pelvic floor exercises can make them drier faster for men. For men with erectile dysfunction, doing your exercises is more effective than Viagra. That's good, right? Good. And these exercises can cure premature ejaculation in 3 months. Even better. So guys are usually quite interested in that, right? The problem is women and men are often left to their own devices to work out how to do these exercises. And 65% of people, they think they're doing them right, but actually they're not. So I often get women coming to see me saying that, oh, well, I've done my exercises and it really didn't work. They dismiss them as being ineffective. But they are effective if you're doing them right, but they do fail for some people. Why do our Kegels, our pelvic floor exercises, fail for so many people? Oops, I've meant to change the slide. Because even if you're trained these muscles to be nice and strong, that does not mean that they're coordinated. They need to work as part of the system that keep you dry, so the continence system, the muscles and everything else. The pelvic floor does not work in isolation. And it's not pelvic floor exercises alone that we use to treat bladder and bowel problems or painful sex or problems after pregnancy and childbirth. No two pelvic floors are the same, and they've all got different requirements to rehabilitate properly. But I'm going to tell you about another epidemic in Wanaka. This is it. It's a Wanaka epidemic. Many people here, they live in fear of that little pook, you know, this little one. I've got one, it's just here. They pin it in strong, super strong, pin it in tight, pin in the lower tummy. Now this knocks out the responsiveness of the rest of the system. The pelvic floor, it becomes overwhelmed from above, and this can create the leaking. But another response, the pelvic floor muscles, they push up in response to that pressure and they tighten right up. Now, this might seem like a good idea, but these women leak too. These ladies tend to be my fitter clients, and they can experience pelvic pain, constipation, painful sex, and problems with tampon use. So I spend a lot of my time turning muscles down as well as getting them strong and coordinated. You should not have to squeeze your butt or squeeze your abs to stay standing up. We don't walk around with our necks on all the time, so we shouldn't walk around with our tummies or our pelvic floor on all the time either. I like to talk to my patients about matching tension to task. Are you lifting a couch or are you lifting a pencil? You need to train your system to engage for how much you need it to, not more or not less. But you must be able to find your pelvic floor before you can use it. So there's lots of examples on how I can get that going, but just for an example, I'm going to give you some, guys. It's a couple here, not too many, but for the boys, imagine that you're walking into Lake Wanaka, okay, and the water's getting it's really, really cold, and you're going in higher and higher and higher, and the next little wave is going to lick you in the testicles. You're going to lift up, right? That's the movement. That's the movement. Okay? For the ladies, listen now. You're going to nod your clitoris down, okay, and down towards your vaginal opening, and you're going to curl your tailbone towards your clitoris. Now, you're going to imagine that you're sucking up a jelly bean off the floor towards your head. You got it? Everyone's got it? Good. Don't put your eyebrows up because I know what you're all doing. Good. Okay, so now you know how to find your pelvic floor. Practice this. Here comes a sneeze. Lift up your pelvic floor, tighten the muscles, hold it. Achoo. Good. Really good. now you can relax, okay? So just as you bring your hands to your mouth when you sneeze, you can catch yourself at the bottom end as well. So you lift up your pelvic floor muscles, hold on to them, then you cough, then you sneeze, then you relax. And this helps you to protect your pelvic organs and helps you to, keeps you dry. That's what it does. Good. So this is a brief introduction to pelvic floor physio, and there's lots more I could talk about. But the main point is, let's not be so embarrassed about talking about these things. Okay, they're so common, and lots can be done to help. We're not going to be embarrassed about talking about incontinence or sex or vaginas or prostates or penises or whatever you want to talk about. Incontinence is more common than having a cold, but it's not okay, and you don't have to put up with it. You should expect to be continent and pain-free, have great sex, and be strong throughout your whole life. Yes, she is lifting a crystal chandelier from her vagina. That's it, I think.